The rainy season began in May in the camp. It's now July and there are downpours nearly every day. For families who fled the war in Sudan, this means that living conditions in the camp are going to worsen. The rains are likely to last until November. In 2012, during the same period, poor sanitation conditions led to the spread of infectious diseases. The mortality rate among young children was significantly above the emergency threshold.
The lessons learned from last year were that malaria, diarrheas, and acute respiratory infections were the main killers. So in order to prevent those diseases to spread in the camp this year, we launched a water and sanitation program, and at the moment we're doing a vaccination campaign to prevent mainly, but not only, respiratory tract infections.
MSF chose the pneumococcal conjugate vaccine for this campaign. This is the first time it's been used under such precarious conditions. 3 series of injections administered over a 3-month period should cover 5,000 children less than 5 years of age. The problem is organising the campaign in the midst of the rainy season. Supplies were delayed by lengthy negotiations with laboratories to obtain the vaccine at an affordable price. This delay prompted MSF to issue a warning. Access to new vaccines for children in crisis situations must be improved. Sebastian lives in Benzambe, north of the capital of Bangui. Like many people, he fled the violence that has affected his country for several months. When he came home, he took stock of the damage.
During the recent fighting, the rebels came to our village and we fled into the bush. When we were hiding in the forest, the hospital was looted and all drugs stolen. Now we have no place to go when we are sick.
Today, an MSF team is in the village. Sebastian thinks he has malaria, so he's come to be tested.
The test is positive. You do have malaria.
Due to this violence that has also hit this village, the little that they had, the little staff that there were, have also fled. So now there's no healthcare at all. And that's the reason that we've picked this location to come and do a mobile clinic here today.
Malaria is not the only threat facing this population. The nutritional situation is worsening, and antiretroviral drugs are no longer available. These problems, among many others, have led MSF and 4 other NGOs to condemn the abandonment by the United Nations and donors of the country's humanitarian and health needs. That withdrawal can only worsen an already alarming crisis. Gaza, late June. Some 30 doctors have gathered at the Al-Shifa hospital. Since it is difficult for them to leave the Gaza Strip, MSF decided to organise trainings on site.
The discipline of intensive care medicine is rapidly evolving all around the world. This is why this course is conducted all over the world. I believe that this course is going to change the practice of intensive care a lot in Gaza.
This 3-day session is devoted to intensive care. The objective is to learn to intervene as effectively as possible within the first 24 hours after a seriously ill patient is admitted.
I hope that this course is going to be run regularly in Gaza. It's going to improve the outcome of the patients and the care of the patients in the critical care field.
The physicians will receive a certificate from the University of Hong Kong upon completing the training, which is recognised by major health institutions. There are also long-term training needs. At Nasser Hospital in Khan Yunis, an MSF nurse who specialises in intensive care works alongside the staff every day. This bedside training programme has been designed to meet the needs of the Gaza population.